the station that's on your side. This is Channel 7 News Daybreak.
All right, the time is 6:23. Welcome back. People who have allergies often also have asthma, and people with asthma often have allergies. They're kind of going together, right? With springtime, right now, it's a great time to look at your symptoms, figure out if you're suffering from asthma, allergies, or possibly both. So joining us this morning to help is Baptist Health Dr. John Allen Cockerell with Sherwood Family Medical Center. Thank you for being here. Thank you for bringing props.
Absolutely.
We love props.
Yeah.
And tell us about why this time of the year you guys really like to heighten awareness on these two things and maybe get some people figured out because they've been trying to figure it out for a long time and don't know what they have.
Exactly right. So a lot of people don't know they have asthma out there. So allergens, that's the biggest thing this time of year. You know, that's an obvious thing, but you think about respiratory diseases in the wintertime, think about flu, bronchitis, pneumonia. Now we're transitioning into springtime. All the pollen, the allergens, all that kind of, stuff in the air can cause people with asthma to have really reactive lungs and cause some serious problems. So that's the reason for the time now.
Difference between the two.
Sure.
Give me asthma first.
Yeah, so asthma, is characterized as a reactive airway disease. So this is deeper down. This is in the lungs.
It's not seasonal.
Exactly right. So this is an obstructive pattern, right? Means there's airflow obstruction. The lungs actually spasm because they're so hypersensitive to the environment around them. So whereas you or I may get a common cold, move on in a couple days, no big deal, the hyperactive lung, the asthmatic lung, really has problems with that, and that's when you can go into shortness of breath and wheezing, some pretty bad outcomes. So it's important to know kind of which one you have so that we can catch it and treat it appropriately.
Okay, and now allergies?
Sure.
Difference in symptoms there?
So a lot of times allergies is going to manifest with more upper respiratory type issues, itchy eyes, sore throat, things of that nature. The two actually do go a lot hand in hand, so that is important to point out too. There's something called the allergic triad, which is eczema, allergies, and asthma. So the three can kind of play together, but again, there's ways to determine between the two. The diagnostic test of choice is called the PFT, the pulmonary function test.
Okay.
If you've ever had asthma, you're out there like, yeah, I know what that is.
Right. Yeah.
Breathe into a tube basically, and it shows us a lot about how severe your asthma is and just what your lungs are doing on the inside.
Okay. You want to bring in a few things today.
Yeah.
These are to help treat the symptoms of those different things you were talking about. Let's start on the end here, Advair.
Sure. So brought some friends with me.
Yeah.
So these are actually all controller agents.
Okay.
So there's two lines of thought with asthma treatment. One is let's get the short acting, get the symptoms down acutely, right? That's with something like albuterol. Advair is actually a combination med. It has both a steroid and what's called a long acting beta agonist with it. But basically this is something you would use for control. Okay. So that you hopefully don't go into exacerbation. So, and I know these other ones, just to save time, here too, these are similar to that. I just brought some different things from the office, right? Because each one of these has a different delivery system. And this guy on the end down here, this is called an aero chamber. Okay. So this actually attaches onto the end of some of these inhalers to help the absorption. Okay. This one's obviously small, it's set up for kids. It's a pediatric mask, but they do make these for adults too. This again just helps to make sure that when you're puffing, off of these inhalers, that you're getting them where they need to go, down in the lungs, and not getting this trapped in your mouth.
Deep down inside is where you got to really inhale. Okay.
Exactly right.
Dr. Cockerell, thank you so much for coming in this morning, explaining all this to us. Hopefully you can stay allergy-free during this spring season. But if you can't, you can contact the Baptist Health Helpline. They have a number of resources to direct you in the right place to make sure that you get those treated.